This video is in continuation to the Rapid Cardiology series, and in this video I will be discussing the high yield facts that you need to know about the mechanical complications of myocardial infarction. So without any further ado, let's get into the video. फर्स्टली जो इमीडिएट कॉम्प्लिकेशंस होते हैं इसमें मेनली तुम्हें 3 तरह के रप्चर्स पता होने चाहिए. ऑल्दो बहुत तरह के कॉम्प्लिकेशंस होते हैं, हाउएवर एग्जाम स्पेसिफिक कॉम्प्लिकेशंस ही मैं इस वीडियो में डिस्कस करूंगा. एंड दोज आर द पैपिलरी मसल रप्चर, द इंटरवेंट्रिकुलर सेप्टल रप्चर एंड द लेफ्ट वेंट्रिकुलर फ्री वॉल रप्चर. लेट कॉम्प्लिकेशंस में द मोस्ट इंपॉर्टेंट वन इज द लेफ्ट वेंट्रिकुलर एन्यूरिज्म. ऑल्दो ड्रेसलर सिंड्रोम एंड और भी कॉम्प्लिकेशंस आते हैं, हाउएवर इस वीडियो का स्कोप सिर्फ मैकेनिकल कॉम्प्लिकेशंस है, सो वी विल बी डिस्कसिंग ओनली दैट. In order to understand these complications and their sequelae well, you need to know their pathophysiology. So सबसे पहले tissue death हो रहा है, that is infarction takes place, that leads to akinesis, मतलब वो area move नहीं कर पाता, which will further lead to shearing stress on the area. If one part is necrosed and उसके side वाला part healthy है, तो वो वाला part expand करेगा. However, जो necrosed part है, that won't be moving, so that will create shearing stress and which will lead to rupture. Now the pathophysiology of the aneurysm is also similar, however ये थोड़ा late होता है. तो इन्फार्क्शन होने के बाद there will be healing and there will be fibrosis. So this fibrosis will make the wall weak and इस weakness की वजह से there will be bulging of the myocardium that will lead to the aneurysm. Now let us understand about the papillary muscle. In the papillary muscle एक बहुत common confusion arise होता है about papillary muscle and the chordae tendineae. To address this confusion, you should know tendon connects the muscle to another muscle. तो इसमें papillary muscle will be connected to the mitral valve leaflet via the chordae tendineae because they are a tendon. Subsequent rupture of these papillary muscles will lead to severe mitral regurgitation. Most commonly जो तुमसे टेस्ट में पूछा जाएगा that will be which artery is involved in this MI, and it is most commonly the posterior descending branch of the right coronary artery that is leading to the rupture of the posterior papillary muscles. The next sequelae that takes place is interventricular septal rupture. अब अगर septum rupture हो जाएगी, it is very obvious. Left-sided pressures are greater than the right-sided pressures. So pressure gradient के हिसाब से it will be a left to right shunt and the blood will go from left side to the right side, and this will cause a ventricular septal defect. The most commonly associated artery is the left anterior descending artery. In high ruptures, in low ruptures sometimes right coronary artery can also be involved. You should also know that ventricular septal defects are associated with a harsh hollow systolic murmur. If your question stem mentions a harsh hollow systolic murmur, you should immediately think of ventricular septal defect. Comment down below an important syndrome that is associated with ventricular septal defects. The next complication we will be discussing is the left ventricular free wall rupture. This is a very dreaded complication because in this the heart is literally bursting open. अब हमें ये पता है कि heart is enclosed within the pericardial sac and the blood will accumulate there. This free wall rupture is most commonly associated with left anterior descending too. Now look at this image. This is an axial CT of the thorax. You can see that there is fluid accumulation within the pericardial cavity. This is a sagittal image and you can also see that there is pericardial effusion. This is the most important part of the video, so ध्यान से सुनना. Tamponade में तुम्हें Bextrad मिलता है. Because the heart is surrounded by blood, it will lead to ineffective pumping. तो the blood will back up and right heart में भी बैकअप हो जाएगा, तो तुम्हें jugular venous distension मिलेगी. And now because the heart is not able to pump the blood pressure will fall. When you will auscultate the heart, because उसके around blood भरा हुआ है, you won't be able to hear the heart sounds clearly. This will lead to distant heart sounds or muffled heart sounds. Coming to the left ventricular aneurysm. नाउ लेफ्ट वेंट्रिकुलर एन्यूरिज्म के ना फर्दर सब सीक्वेले होते हैं, मतलब जो कॉम्प्लिकेशन हो रहा था एमआई का दैट इज लेफ्ट वेंट्रिकुलर एन्यूरिज्म, बट इस लेफ्ट वेंट्रिकुलर एन्यूरिज्म की वजह से फर्दर कॉम्प्लिकेशंस हो जाते हैं दैट आर हार्ट फेलियर हो जाएगा बिकॉज द वॉल इज इनइफेक्टिव एंड इट वोंट बी एबल टू पंप द ब्लड, सो इजेक्शन फ्रैक्शन विल रिड्यूस. Because the myocardium is dilated, it will also lead to conduction system abnormalities and therefore ventricular arrhythmias, most commonly ventricular tachycardias. You will also get a refractory angina and the patient will classically complain of a substernal crushing pain. Another important complication that can arise out of the aneurysm is a mural thrombus. Because वहाँ dilated part है, the blood will stagnate there. And you all know what the Virchow's triad of thrombosis is. If there is stagnation of blood, that will lead to thrombosis and that can lead to further embolization. Another interesting कॉम्प्लिकेशन इज अ सूडो एन्यूरिज्म। इसको सूडो एन्यूरिज्म इसलिए बोल रहे हैं बिकॉज इसमें डायलेशन नहीं हो रहा, इसमें फ्री वॉल रप्चर हो रहा है, बट एक लेयर बाहर की रह गई। सो वो दिखता है एक डायलेशन जैसा, बट इट इज एक्चुअली अ रप्चर। सो वी कॉल दैट अ कंटेन्ड रप्चर एंड ऑल्सो द पेरिकार्डियम इज अडहेरेंट इन दिस, देयरफॉर वो दिखता है एक एन्यूरिज्म की तरह, हाउएवर इट इज नॉट वन। The investigation of choice for all of these will be an echocardiogram. So if you are asked the next best step in management, it will be an echocardiogram to diagnose these complications. Now that we have covered all the complications, let's have a Q&A session. What will be the murmur that is seen in papillary muscle rupture? Pause the video and try to answer. Because there will be severe mitral regurgitation, during systole, the blood will back up into the atria because the blood is regurgitating up, so that will cause a hollow systolic murmur. Patient had an MI 2 months back and now complains of left-sided weakness in both arms and legs. Because the patient had it 2 months back, this is a late complication of MI, that is a left ventricular aneurysm, and वहाँ पे एक neural thrombus बन गया that embolized and caused a transient ischemic attack. Patient recently had an MI and now complains of shortness of breath and is unable to sleep. What is your diagnosis? This patient had a papillary muscle rupture. एंड उसकी वजह से सीवियर माइट्रल रिगर्जिटेशन हुआ एंड द ब्लड बैक्ड अप इनटू द लंग्स बिकॉज हार्ट फेलियर हो गया। दिस हार्ट फेलियर कॉज्ड एन इंक्रीज इन द पल्मोनरी कैपिलरी वेज प्रेशर एंड इस वेज प्रेशर इंक्रीज की वजह से पल्मोनरी इडीमा हो गया, जिसकी वजह से व्हेन द पेशेंट इज लाइंग डाउन देयर इज पल्मोनरी कंजेशन एंड ही इज कंप्लेनिंग ऑफ ऑर्थोपनिया. ही इज अनेबल टू स्लीप बिकॉज ही इज हैविंग paroxysmal nocturnal dyspnea (PND). Paroxysmal nocturnal dyspnea is most commonly seen after 2 hours of sleep because the person enters into REM sleep and REM sleep में sympathetic activity बढ़ जाती है. That increases the workload on the heart and that precipitates the congestion. इस congestion को precipitate होने की वजह से patient suddenly wakes up and complains of shortness of breath. That will be all for this video. If you have not understood, try to go back and rewatch the video. All the questions at the end of this video were high yield and will most likely be tested on your exam day. I hope you liked the video. Thank you.